I know that so many people are confused as to whether to start their nursing career on the med-surg floor or on the critical care unit. In this video, I'm going to be listing to you the pros and cons of being a critical care nurse, and I will leave you with a decision as to whether you want to become a critical care nurse or you want to just start off as a med-surg nurse or working in a facility. Stay tuned, guys, because you will definitely want to know what are the pros and cons of a critical care nurse. Hi guys, and welcome to my channel. In this video, I'm going to be listing you all the pros and cons of being a critical care nurse. I definitely will be starting with the pros. The very first pro is going to be that you are going to have to be a detail-oriented person, and you're going to have to be a very observant person. Detail-oriented in the sense that being a critical care nurse, you focus very closely on the different systems of a patient. You have to look into the patient's neuron, you have to look into the patient's GI, respiratory, cardiac, and skin, and every system that entails a patient. You may not necessarily dive deeper into all these systems. You could be more so focused on the reason why the patient is in the hospital in the very first place. Take, for example, a patient comes to the hospital for a GI bleed. The patient is on room A. There is no need for you to be very detail-oriented into the patient's respiratory issues. You're going to be digging into the patient's blood labs. What do they look like? You're going to be digging into, hey, what is the patient's diet like? Do the patients smoke? Do they drink alcohol? Those are the kind of things that you're going to be focusing on. And so being a critical nurse, you're also going to be very observant. Let's say if a patient comes for a cardiac issue, most of the times cardiac, respiratory, and to some extent kidney are all related. And so if you're watching out for a patient who comes to the hospital for, let's say, maybe like a congestive heart failure, you also want to be watching out how much are they peeing, which entails the renal function. You want to also watch out, hey, are they being fluid overload? How is their breathing like? How is their lung sounds like? That is the respiratory aspect of it. And then when it comes to the cardiac aspect of it, you will also be monitoring, hey, what do their blood pressures look like? What does their heart rate looks like? And if they are being symptomatic or asymptomatic with all these, negative outcomes that entails the medical diagnosis that they are in the hospital for. So one very big thing you have to know about the pros of being a critical care nurse is that you are going to have to be detail oriented, and you're going to be very observant. This is one thing that I love. I love looking at the patient and knowing or figuring out why is this patient like this? If this patient came in with congestive heart failure, probably they are going to be on diuretics. If they are on diuretics, what do their potassiums look like? If this patient has congestive heart failure, what do their blood pressures look like? If this patient has congestive heart failure, what do their chest x-rays look like? Are they fluid overload? What is their blood pressures like? Hey, if this patient came in for congestive heart failure, how much are they peeing? If they are actually getting diuretics, how much are they peeing? You are going to know that monitoring the I's and O is going to be a very important thing, especially if they are on diuretics. If they are getting the diuretics and they are not peeing, could it be that they are retaining? Could it be that they are having urinary retention? If they are having urinary retention, could it be that I need to bladder scan them? If I bladder scan them and they are having more than 500, I need to let the provider know. The provider will have to make the decision as to whether the patient needs a straight cath or the patient needs an indwelling Foley catheter. This is how you will have to be thinking when you are a critical care nurse. I, for example, love when my brain is thinking. I, for example, love when I have to be thinking and connecting the dots when it comes to the care of my patient. And so if this is something that you love about being a nurse, then the critical care unit is definitely for you. The next thing about being a critical care nurse is the autonomy and the confidence that the providers have in you. Let me go detailing into this. Most of the times when I am being floated to the med-surg floor, at least in my hospital, right, the nurses on the med-surg floor are not allowed to draw labs from a PICC line, and I'm like, it's just a PICC line. But well, that is a protocol of my hospital. But when you are on the critical care unit, that is something you do so easily. You are probably doing it so often that is not even a cause for concern. There's so much confidence that will lead to a certain autonomy when it comes to you caring for your patient. Take for example, I had a situation wherein my patient's blood pressure was low, and before I even called the provider, I put this patient in the Trendelenburg position. Probably if you're in the less critical care unit, you probably will not be allowed to do that, but in the critical care unit you can do that whilst you reach out to the provider to get maybe like a bolus for this patient, and any other thing that could help the patient's blood pressure come up. So there's some sort of autonomy when it comes to what to do for the patient when the patient presents with a situation. Take for example, on my floor as a critical care unit, I can titrate my patient's oxygen from a 4 to a 6 to a 8 to 10 to a non-rebreather 15, and that is it. If the patient is going to need high flow, if the patient is going to need a BiPAP, then I'll have to call the respiratory therapist to come and do that. But I should make sure to mention this, that whilst I am titrating my patient's oxygen from 2 to 4 to 6 or whatever number I have to titrate it up, I always make sure to tell the provider, hey, this is something new. Maybe the patient needs ABG, maybe the patient needs an X-ray, maybe the patient needs a breathing treatment. So these are things that you can suggest to the provider as well, and these are things that you are allowed on the critical care unit to do, as opposed to the med-surg floor where it depends on the hospital. In some hospitals, when the patient gets to like 5, the patient has to be titrated up to 6, 7. They are no longer considered med-surg appropriate, and they have to be brought to maybe a step-down unit or probably ICU, depending on how much oxygen they need. So the autonomy and the trust and confidence that providers are going to have on you is very, very big, and I love that autonomy. I love that autonomy. The next thing on my list is going to be you working closely with providers. I work as a step-down nurse. The cross cover or the doctors are very, very often seen or seated on the floor on my unit. In some hospitals, they actually have a doctor's office where the doctors sit there, especially during day shifts. They sit there all through the day and they attend to any pressing needs that the patients are going to have whilst on the floor. But on the med-surg unit, this is not going to be the case. So that closeness with the doctors, that availability to easily get the doctors when you need them for a certain thing that has come up for a patient, is one very good thing I love about working on the critical care unit. You can also run your thought process as to what you think about the patient care to the provider, and they'll be like, I think that you're right, let us try that. But on the med-surg floor, the doctors are actually rounding, they are moving from place to place. But on the critical care floor, especially and always on the ICU, but not on every step down unit, the medical doctors, the neurologists, the cardiologists, the kidney doctors, the specialty doctors are most at times or sometimes seen on the floor. And so that rapport that you will be talking with the medical doctors is something that I love about being a critical care nurse. The next thing about being a critical care nurse that I love so much is the patient ratio. Look, on the med-surg floor, I don't know how the med-surg nurses survive with 6, 7 patients in some hospitals, because I just feel like 6 human beings to be able to master or keep their history and their information in my head is just going to be too much. I love the fact that on the critical care floor, on the step down unit, in some hospitals it's going to be 4 patients for 1 nurse, in some hospitals it's going to be 5 patients for 1 nurse, and in the ICU, in some hospitals it's going to be 3 patients for 1 nurse, depending on the severity or the acuity of the patient. But in most or majority of the ICU units, it is most of the times 2 patients for 1 nurse, and depending on how much need that the patient will need from the nurse, there are some ICU nurses who will have 1 patient for 1 nurse. Take for example, the patient is needing CCRT, which is kind of like a dialysis. So this specialized nurse who is trained for that CCRT can actually have just that patient to care for that shift. So the very big thing about working on the critical unit is the patient ratio. I love to have 4 patients that I focus on, 4 patients that I can easily remember their histories, 4 patients I can easily remember their diagnosis and what is going on, as opposed to the med-surg floor. I'm sorry, I'm calling the med-surg floor. It's even worse in, the facilities where one nurse is going to have like 30 patients. I really don't understand or know how those nurses function. I really don't understand how they do it, but kudos to them. I love my 4 patients to 1 nurse. I love the fact that I am in depth in terms of the information that I know about my patient. So the patient ratio, kudos. I love that. The next thing about being a critical care nurse is the availability of equipment on the floor. Given that these are patients that are critical, there's going to be the easy access to equipment, maybe the bladder scanner. We have the telemonitors that are constantly monitoring our patients, because our patients are all, except in some rare cases, always hooked to a cardiac monitor that is monitoring their blood pressure, their heart rate, their O2 sats, their respirations, and then the techs go ahead to take their temperature. So we are constantly in the know of what their vital signs look like. You will have access to all these equipments that will make your life or your shift much more easier. So I love the fact that we have, especially like the respiratory, different masks that are needed for the patients, oxygen needs if they should increase. We have all those on the floor. So the easy access to the equipment that are going to be needed to care for your patients are going to be found on the floor, and that just makes your whole shift go so smoothly and very easy. Next thing on my list is going to be collaboration, but I will say this with a caveat because it depends in the hospital. I have worked in a facility or a hospital wherein teamwork was not a very big thing. But I have also worked in another hospital wherein teamwork was amazing. Let me explain what I mean by teamwork. We all care for critical care patients, and if one nurse is receiving maybe a newly admitted patient from the ED, guess what happens? All the other nurses come into the room and help the nurse, get settled with this new patient. Is there anything that you want? Do you want me to get the pulse oximetry? Do you want me to get the telemetry leads? Do you want me to get the telemetry stickers? There is just an amazing teamwork that makes your shift, that makes your work so easy. So the teamwork when it comes to working on the critical care unit is so amazing. I know that even when I flow to the ICU as a resource nurse, the ICU nurses who are caught up with their documentation, who are caught up with the care for the patient, they're going to be walking around and they're asking the other nurses, hey, is there anything you need me to help you with? Is there anything that your patient needs that you want me to quickly jump in and help you with, because I'm currently caught up with everything that I need to do. So that teamwork is amazing when it comes to the critical care unit. Next thing about working on the critical care unit is you are going to learn so much about the medical diagnosis of patients. On the med-surg unit, I like to think of that unit as a task-oriented unit where you get to give the patients medications, you get to call respiratory therapists to come and give the patients breathing treatment, you get to work with the patients, you get to give them their pain medicine if they need it. But on the critical care unit, you are actually more focused on the medical diagnosis of the patient. I just mentioned if a patient comes with a heart failure, you're monitoring their vital signs, you're monitoring their labs, you're monitoring, okay, what other thing can I suggest to the medical practitioner or to the doctor. You're also monitoring like, hey, what if the patient might be getting into this situation? Okay, what are the things to look out for if the patient is actually getting into that situation? I wonder, does the patient normally have this whilst they are at home? I wonder, okay, if the patient has this situation, that means the patient will probably be going home with this kind of situation. So let me look into what I can do in terms of the patient's current situation to be able to manage all of these things. And so on the critical care unit, because you have so many things to coordinate, you're going to be doing in-depth assessment, you're going to be doing in-depth monitoring, you're going to be doing, much more frequent labs, you're going to be doing much more frequent checking up on the patient, assessing the patient, documenting on the patient, reaching out for more things when it comes to what to make the patient much more better. in terms of, whatever medications. Maybe the blood pressure has dropped, maybe the blood pressure has increased and you don't want the patient to stroke out, or maybe the patient's oxygen needs have increased and maybe we need like a start ABG, or we need a start chest x-ray. So you're going to be very much in depth with the medical condition, the medical diagnosis of this patient. Again, I love to be into my patient, to know everything that is going on with the patient and so forth. So I find this as a positive thing about being a critical care nurse. Whereas if you're someone who just wants to pass medications, if you don't want to get yourself so medically involved with what the patient is in the hospital for, you can always go to the med-surg floor. I always say the med-surg floor is for patients who are just passing through in the hospital, because most of the times those patients are probably just getting their home medications and the less acuity medical diagnosis that they have, and sometimes they will be there for like 2, 3, 4 days, also depending on if they are being planned to go to a facility that could probably elongate their stay in the hospital. So that is another thing. You have to know that you're going to be so in-depth when it comes to the medical diagnosis and the things to look out for when you are a critical care nurse. Another thing I love about being a critical care nurse is that it is very easy to advance into a higher level of the nursing career. Because we're talking about the nursing career here, it's also easier to advance to like maybe ICU. It's also easier to advance to like a nurse practitioner or a critical care nurse practitioner, or why not a CRNA. So when you are in depth with your patients, when you know all these medical diagnoses, it also makes it very easy for you whilst you're in a nurse practitioner program, because I feel like going to a nurse practitioner program is you having to take care of patients who are going to be critical. And so if you're already working on a critical floor, it's going to be much more easier for you to understand the pathophysiology of some of the medical diagnoses or some of the medical conditions that patients are going to have in your career in the future. So it'll be easy for you to be able to interpret labs, to interpret x-rays, even though there are people who are designated to interpret those. But it's going to be easy for you to understand certain labs, certain ABG values, and certain conditions, what to give them, what to look out for, what to do, what to anticipate. Graduating in terms of going higher in the career ladder when you are a critical nurse is much more easier as opposed to a med-surg nurse. I am not saying that it is difficult for you to become a nurse practitioner if you work on the med-surg floor. Probably it might be easier if you work on the med-surg floor for a very long time, in terms of you being a very experienced nurse due to the time you have served as a nurse. But it's going to be much more easier if you're a critical care nurse to actually go into the nurse practitioner program and ace it like a breeze. The next positive thing I love about being a critical care nurse is that, like I'd already mentioned, you are so focused on the medical diagnosis of the patient, as opposed to, oh, the patient needs water, you need to go get them water. Oh, the patient needs ice, the patient has not eaten, the patient needs ice cream, the patient needs to take a shower right now. You're much more focused on the patient's diagnosis. And so some little things, I won't say that we kind of ignore it, but they are not as important over the medical diagnosis of the patient. Like I said, the med-surg floor is that floor where the nurses are more so task oriented, as opposed to the critical care floor where the nurses are more so patient medical condition oriented, in terms of making sure the patient is safe, the patient is alive. I'm sure so many of you people are new nurses on my channel. If you're finding all the videos that I post on my channel interesting, please do not forget to subscribe, like and share, and let's continue this video. Moving on now to the cons of being a critical care unit nurse. The very first one is going to be, this is a floor where we take care of like patients who are withdrawing either from alcohol or drug abuse. So these patients are going to be so difficult, they're going to be demanding, they are going to be needing maybe pain medicines back and forth. If they are on CWA protocols, they're going to be needing the Ativan because they're withdrawing. If the patients are stroke patients, you are going to be giving them, back and forth high blood pressure medications. So these are patients that you are going to be so focused on back and forth taking care of their medical diagnosis as well as their should I say, mental stability, because these patients are going to be so demanding, especially patients who are withdrawing. Some of them will tend to lose their orientation. Maybe they can come to the hospital being oriented ×4, and before you know it, at the end of your shift, they are oriented ×2. They are confused, they're asking for every sort of thing, or you are just giving them Ativan back and forth, but probably it's not helping. The patient is actively wanting to jump out of the bed. The patient is probably throwing things. You probably are thinking of putting the patient on restraints. So just be on the lookout that being a critical care nurse, you are going to care for patients who are going to be unruly. No, you're going to care for patients who are medically sick, but they are also unruly. So that is one big thing you should be looking out for, especially the patients who are withdrawing. The next negative thing about being a critical care nurse is going to be you're going to be taking care of patients who are crashing. I'm talking about patients whom you'll be calling a react on them. I'm talking about patients that you're going to be calling a sepsis alert. You are going to be they are probably going to be coding. You are going to be doing code blues. You are going to be giving adenosine. You are going to be giving them kind of like high alert medications just to keep them alive. These are going to be patients that you're going to be running back and forth. You're monitoring their blood pressure, you're monitoring their oxygen. The patient's oxygens are going down, blood pressures are going up or they're going down. You're worried about whether they're going to stroke out because of their blood pressure. So these are patients that are going to be crashing out. So this is going to be a very high stress environment. And so if you're not somebody who can work in a high stress environment, I'm going to tell you that you probably might want to start on the med-surg floor. But that does not mean that you cannot start on at least a step down unit and then move your way to an ICU unit, and then who knows, become a CRNA if that is what you want, or a critical care nurse practitioner. But the most important take home from this point is that you have to remember that you're going to be taking care of patients who are going to be crashing. I have had 2 of my patients code at the same time. One of them had a code blue and the other one they called a react at the same time. So I had to stay in the room with the patient with the code blue, while other nurses had to go into the patient who had like the sepsis alert. So the patient who had the sepsis alert, their heart rate was increasing, they had a temperature, their blood pressure dropped. So these were the 3 things that made the charge nurse to call a sepsis alert on this patient. While my other patient who was in the code blue, there was no way I could leave because I was a primary nurse and I had to be able to give the rundown of what happened to the patient leading up to that point. So you're going to be caring for crashing patients, and so your adrenaline is going to be pumping. You are going to be on your feet and you're going to be answering questions. You're going to be assessing your patient. You're going to be monitoring your patient. So this is going to be a unit where you're going to be caring for patients who are crashing. So keep that in mind. If that is not something that you're comfortable with, then you might have to weigh your options. The next thing, which is a cons for working as a critical care unit, is going to be the high stress. Like I just said, it is very easy for you to carry the stress from work back to your home. It is also very easy for you to carry the stress from your work into your social life, into your family. And so you have to be able to manage the adrenaline that you kind of have at work and separate that from that which you probably might be pouring in your family. So learn how to control yourself, learn how to be composed, learn how to be prepared, especially learn how to be so prepared for anything. If your patient is in the hospital for high blood pressure crisis, just be looking out for maybe the patient can have a stroke. If your patient is on oxygen, high oxygen demands, you should be looking out for maybe calling a REA because probably the patient might be intubated. If the patient came in just know why the patient is in the hospital and know what to monitor, because it's going to look very bad if a patient crashes and you don't even know how to respond to the situation. So that is going to be one thing. Like the adrenaline level here is going to be so high. So the stress on the critical care unit is one of those things that I'm not very comfortable, but I am comfortable with, if you understand what I mean. The next thing about working as a critical care unit, which I don't like, is that the patients are so heavily dependent on you. You have to be constantly turning the patient, you have to be cleaning them, you have to be emptying their Foleys or their canisters, you have to be suctioning them if the patient has a trach collar and they need constant suctioning, if the patient is on high flow and they need the Foley just because, or if the patient is on BiPAP and they need their Foley, you have to be emptying your Foley. If the patient had a stroke and they are weak and cannot turn themselves, you have to be turning the patients back and forth. If the patient is incontinent due to like maybe a neurogenic bladder, if the patient has cerebral palsy, if the patient has multiple sclerosis, those kind of conditions that make the patient heavily dependent on you, then these are the patients that would wear you out physically. You will have to constantly be turning on them, you will have to constantly be checking up on them, because at that point they are like babies to you. They look up to you for everything, all of their needs in the hospital. And so it's going to be very physically demanding or tasking on your body. And so if you don't have that teamwork on your unit, if you don't have the staff, if you don't have the help, it's going to be so physically draining at the end of your shift. So that is one cons about working on the critical care unit. And on the ICU, definitely these are patients who are intubated. You need to make sure that they are always hygienically clean, because you have to be doing CHG bath on them. You have to be turning them and making sure that you are turning them in such a way that you don't dislodge or mistakenly get the patient into trouble in terms of maybe the machine, maybe you tamper with the machine, or maybe something happens with their intubation system or the breathing machine that they are on. So that is one thing about the physical demandingness of being on the critical care unit. Next thing about working on the critical care unit, which is a negative, I know some of these things might be positive for me, some of these things might be positive for you, some of these things might be negative for another person, some of these things might be positive and negative depending on how you see your personality to be and depending on of patients that you like to care for. The next thing about the critical care unit, which is a con for me, is the frequent documentation. Like I said, these patients are going to be needing constant monitoring, they're going to be needing constant care, they're going to be needing constant checking, and there's no way that anyone is going to know that you've been constantly checking on them if you don't document it. There's a very popular saying in the nursing career that if it was never documented, then it never happened. If you did not document that, hey, the patient was alert and oriented at midnight, and if that patient becomes confused, there's no way for them to be able to tell, hey, at what point did the patient become confused. If you do not document that, hey, you actually changed the dressing for the patient's wound, there is no way that anyone is going to know that, hey, the dressing was changed. So there's going to be frequent documentation, there's going to be frequent things you're going to be doing, there's going to be frequent medications or much more higher acuity, or yes, the frequency of certain medications. So you have to be documenting, make sure you're scanning all your medications, everything you do for the patient, always document. I&O is going to be a very big thing on the critical care unit, because we want to make sure that everything that the patient is taking in actually goes out. We want to make sure the patient is not retaining. We want to make sure that the patient's bladder or the urinary system is actually functioning properly. So there's so many things to document, and if you're not somebody who is computer savvy, you're not somebody who is comfortable with computers, if you're not somebody who is comfortable with typing, if you're not somebody who is comfortable sitting in front of a computer for a very long time because you have to be documenting very frequently, then probably this is going to be one of those things that you might not like about the critical care unit. On the med-surg unit, they document assessment on their patients just one time, usually at the beginning of the shift. But on the step-down unit, we get to document every 4 hours in terms of assessment, reassessment, and reassessment on our patients. So we tend to document at least 3 assessments on the patient. And on the ICU, they tend to document every hour on their patient, which is the more reason why the more documentation or the higher the acuity of the patient, the lesser the patient ratio per nurse. There's no way that an ICU nurse who has to be documenting in-depth documentation about the patient every hour is going to survive it with 4 patients. Like, it's not even going to happen. The nurse is going to end their shift with like brain fatigue. It's not going to be feasible. It is not achievable. And so documentation is going to be a very big thing when it comes to the critical care unit. Just make sure that you are comfortable with your documentation. You know what to document. You know what to go in depth when it comes to the documentation, and you know what to look out for if a documentation looks funny. Take for example, a patient comes with CHF, congestive heart failure, and they are saying that the patient is retaining fluid on their body, but then the previous nurse is documenting that the patient doesn't have edema. That is going to be a call for concern, because you will have to go back and assess to see whether that patient actually has an edema or not. So in-depth documentation, frequent documentation on critical care unit is going to be a big thing that if you're not comfortable with, just know you have to find a way around it. The next thing about the critical care unit is going to be the constant labs and monitoring. I've already said this over and over. If you're not comfortable with labs, sometimes you will have to draw your own labs. In the ICU, yes, the nurses are responsible for drawing their own labs. On the step down unit, we have phlebotomists who come and do it, but you will have to constantly be monitoring certain lab numbers when it comes to your patients that you're caring for. So make sure that you're confident, make sure that you are comfortable when it comes to what to look out for, what to monitor in the patient, what labs to look out for and what labs to monitor, what labs or what things you can suggest to the provider or to the doctor in terms of, hey, I think that we should monitor this. Don't you think that getting this lab for this patient is going to be necessary? So there's going to be constant monitoring, there's going to be constant labs on the patient. So if you're not comfortable with this aspect of monitoring back and forth, then probably the critical care unit is not for you. The next thing and the last thing about the cons about working on the critical care unit is that the patients on this floor need more attention than on the med-surg unit. Again, like I said, most of the times when I'm being floated to the med-surg unit, it's more so giving them their night medication and there's nothing else to do. Granted, some of them will have IV antibiotics during the night. Some of them will call for like maybe a sleeping medication, pain medicine, or maybe for some reason they want like a breathing treatment. Sometimes it will be time for them to switch or put on their CPAP or their BiPAP, depending on what the needs are for the BiPAP. And so you have to call the respiratory therapist. But on the critical care unit, the patients are looking up to you for Foley's. You have to monitor and document the input and output of the Foley's. You're monitoring different drips for the patient, insulin drips, cardiac drip, basically blood pressure drips, drips that will help to also diurese the patient. And there's several drips that you're going to be giving this patient, and there's several things that you'll be monitoring when these patients are on this drip. Take for example, if the patient is on heparin drip, you have to keep monitoring the patient's anti-XA or the APTT depending on what is needed for the heparin drip for that patient. If the patient is on the cardiac drip, you have to keep monitoring the blood pressure. Sometimes you have to turn it off, turn it back on, turn it off, turn it back on. So you're going to constantly be monitoring these patients. Another thing too is going to be if the patients are on tube feed. Yeah, tube feed patients can also be taken care on the med-surg floor, but hey, if the patients are coming with all these complex medical diagnoses and they have tube feeds on top of it, hey, you also have to be using your critical nurse thinking to be able to be like, hey, because this patient is on tube feed, you have to always remember that the patient should be sitting upright. If you have to clean the patient, make sure that you remember to turn off the tube feed. If the patient is on the tube feed and the patient is having respiratory issues, if you suspect any aspiration, you want to make sure that you're auscultating the patient's lungs to check if the patient, or if you suspect any aspiration from the patient. So these patients are going to be needing constant monitoring, constant documentation. And so if that is something that you're not comfortable about, then probably the critical care unit is not meant for you. I hope that after listening all the pros and cons of being a critical care unit, you can find yourself on whatever camp you are. Are you on camp positive or are you on the camp negative? Do you like being a critical care unit nurse? Let me know what you think. Thank you for staying right up to the end of my video. And from me to you, I'll see you all in my next one. Stay blessed, keep liking, sharing and subscribing, and I'll see you all on the next episode. Bye guys.